Good evening once more, and I would love to welcome you all to our Womb Care Clinic webinar, where we'll be talking about uterine fibroids. My name is Dr. Mweemba Musoba. I'm a consultant obstetrician and gynecologist. I'm also a fistula surgeon and fertility specialist from Womb Care Clinic in Solwezi. The month of July is Uterine Fibroid Awareness Month. And I came across this particular reading, which was an extract from a BBC interview that was done. I don't know, many people didn't know this, and I didn't know this as well. But Lupita Nyong'o, famous actress, is a Black woman who's been suffering from uterine fibroids, and she did get to tell her story. But in the particular extract that was there, it was quite interesting to just quote what Sateria Venable, who is a founder and CEO of Fibroid Foundation in the USA. And this was the extract. Living in the USA, Sateria has had multiple surgeries to manage her symptoms, but explains how many women are continuing to suffer. A woman sitting across from you at work who's smiling and having a conversation may be dying inside and feel horrible. Society has taught us we should not reveal that agony. And that was the quote from Ms. Sateria Venable, who's the founder of Fibroid Foundation. Her story is quite interesting as she's undergone close to 4 surgeries for uterine fibroids. And her initial diagnosis, I think the doctor who she saw even said you needed to undergo a hysterectomy, which is the removal of the uterus itself. And that was something that she wasn't agreeable with. And I think based on this particular background, not just her story, but the story of so many other women that suffer silently with uterine fibroids. In July, as a clinic, we joined the world in raising awareness towards uterine fibroids and just trying to shed some light, just in case there's a woman out there or there's a sister, a wife, a friend who might be undergoing this particular disease and suffering from it, to tell them that there is hope and there is help available out there. My presentation will be quite short. I'll try not to go into so much detail, but just to shed a few light on what fibroids actually are, what are the risk factors of one developing fibroids, signs and symptoms of uterine fibroids, and how do we get to manage these fibroids. And then I've dedicated a short slide to just busting some of the myths that are associated with uterine fibroids. So what are uterine fibroids? Uterine fibroids are simply growths that happen in the uterus of a woman, in particular in the muscle area. So you find that the muscle area starts to undergo certain changes that predispose that area to overgrowth in terms of how it responds to the normal hormones that keep a woman being a woman. So you find that these growths can happen in the uterus in more than just one position. You can have one, they can be multiple, but these particular growths happen in the muscle of the uterus. Fibroids are also called as leiomyomas or myomas. So it's just important for us to know, just in case your doctor throws in certain jargons that we might not be able to understand. If you look at some of the facts that are there about uterine fibroids, they are the most common pelvic tumors in the female reproductive organ. So fibroids are extremely, extremely common. The goodness about them is that fibroids are not cancerous. So these are just growths that are happening in your uterus, but fortunately enough, they're not cancerous. And they are 3 times more common in Black women. So you find that being of African descent, being Black, just simply increases your chances of developing uterine fibroids. Studies have shown that women below the age of 50, you find that there's a 20 to 80% chance of them suffering from uterine fibroids. Other research has shown that 6 to 8 women out of 10 actually do have uterine fibroids, and this shows that the numbers are quite high. So what are some of the risk factors of a person developing uterine fibroids? Risk factors are simply certain aspects of a person that might predispose them to actually getting a disease. So you find that number of pregnancies is something that is there. There's this sort of common phrasing which says that if a baby won't grow in the uterus, something will grow in there, and that's where you get the fibroids coming from. Research has shown that a woman who has carried a pregnancy at least about 5 months has got a lower chance of developing uterine fibroids. Race is also a risk factor, just like I mentioned. Fibroids are very common in the Black population. Also, the age at which one starts their periods is also a risk factor. This is something that we cannot really change, but it's been shown that girls that start their menses very early because of the long-term exposure that they have to the hormones that make them have these menses are at a higher risk of actually developing uterine fibroids. And then there's also the family history part of things, where it simply runs in the family because there are certain genetic predispositions that are there in the family, and they're passed on from mother to daughter and going down the lineage. So lifestyle as well. Lifestyle plays a critical role in most disease processes. And you find that in uterine fibroids, it's been shown that a diet rich in red meat has predisposes somebody to having more of a chance of developing uterine fibroids versus somebody that has a more sort of green diet. So diet is something that is key. You find that alcohol as well predisposes people. Smoking, on the other hand, has got some protective effects actually against developing uterine fibroids. Though that's not to say people should go out there and smoke, because smoking does have so many harmful effects on the body. Age as well. You find that the older somebody gets, the more their body has been exposed to the natural hormones that have made them go through their menstrual cycles. And you find that in terms of peak period, when people develop fibroids, these are women above the age of 30 that start developing this, 30 to 40 years old, and that's the time that they actually develop these fibroids. High blood pressure has also been linked to the development of fibroids. That's why I believe that lifestyle is something that is absolutely important in the prevention of some of these diseases. So, what are the signs and symptoms of uterine fibroids? When it comes to the signs and symptoms of uterine fibroid, first of all, it's important to know that uterine fibroids can be completely asymptomatic, meaning somebody will not even know that they actually have uterine fibroid. And you find that the majority of women that actually come through to the clinic and they're found with uterine fibroid is because they were undergoing, for example, just a routine scan for another pelvic pain or disease that they were having, and then it was found incidentally that they actually have uterine fibroids. So you find that majority of fibroids are asymptomatic, no signs, no symptoms whatsoever. However, if the fibroids do become symptomatic, it's important to note that some of the signs and symptoms that people present with are usually heavy or prolonged menstrual bleeding. This type of bleeding is extremely bothersome to some women, where you find that a woman is changing more than 6 pads per day, fully soaked, which is quite worrisome, or passing menstruation with clots. Those are some of the signs of heavy bleeding, where once somebody goes on their periods, they start getting dizzy, they start getting heart palpitations, to have this sensation that your heart is actually beating very fast. Those are some of the symptoms that are there in terms of bleeding. There's also painful menstruation. Every time a woman is having her periods can be extremely painful, to a point whereby she might not even be able to go to work or go about her day-to-day activities. And sometimes you need heavy painkillers for her to just be able to manage the pain that she's going through. Other symptoms include pressure symptoms. So, when we talk about pressure symptoms, these are related to the bulk and size of the fibroids themselves. You find that if the fibroids are big, they can actually compress on the woman's bladder, which sits right in front of the uterus. They can also compress on the woman's rectum, which is right behind the uterus. And these can cause urinary symptoms where, a woman has got this urge to frequently urinate, or even after urinating, you feel as if you haven't fully emptied your bladder. So those are some of the signs that can be there. And very large fibroids can also cause constipation. Why? Because they might be so big that they're pressing on the rectum itself. There can be also some reproductive dysfunction that comes with uterine fibroids. Fibroids have been associated in some to cause infertility based on the position that they are on, and they can also cause miscarriages based on the position that they're actually found in. They can also cause pregnancy complications such as preterm delivery. You find that for some women that have got fibroids whilst they're pregnant, they might experience constant abdominal pains or pains that require them to be going to the clinic a little bit more frequently than what you would see in a pregnancy without fibroids. So this image is very, very important because it simply gets people to understand where exactly these fibroids can grow. So the fibroids can grow inside the uterus itself. They can grow just within the muscle of the uterus, or they can grow on the outside of the uterus. It's important to note that the position of a fibroid is what heavily contributes to the symptoms that a woman might actually feel with the fibroids. So you find that sometimes the fibroids might be very small to a point whereby they do not cause any symptoms. And sometimes the fibroid might be so large that they're actually causing persistent symptoms, which can be the ones that I mentioned, where they can be heavy bleeding, they can be pressure symptoms, or they can be symptoms that affect one's fertility. So, how do you go about making a diagnosis of uterine fibroids? Like I said, most uterine fibroid diagnoses are simply incidental, meaning a woman has gone to the clinic, she's not feeling well, and she just says, okay, I need to do a scan. You do a scan and you find these fibroids that are actually there. Sometimes you find that a woman might come to the doctor's call room or consultation room and she'll present a certain history that is suggestive of uterine fibroid. Some of the complaints that will be there in the history, or some of the complaints that your doctor might elicit is, are you having painful period? Are you having heavy bleeding? And those are some of the pointers that might lead to a diagnosis of uterine fibroid. And you find that in all of this, an examination is also important. So in terms of an examination, you find that your doctor might have you lie down and he might do some abdominal palpation where he feels your abdomen where the uterus is supposed to be. And if he or she finds that the uterus is larger in size than it's supposed to be, then they might be assigned to say, okay, there's something that might be growing in there. A vaginal examination is also done during your evaluation so as to understand the bulkiness of your uterus and to also understand whether or not the areas feel free. And this can be important in terms of your treatment and your plan to be given. Imaging, ultrasound is the image of choice, and it is a very, very safe procedure that can be done on a woman with no harm whatsoever. So when it comes to treatment of uterine fibroid, it's very, very important to know that one size does not fit all. And I think this is something that we try to emphasize to any woman that comes into a consultation room. Just because patient Y received this type of treatment doesn't mean that you as well are going to receive the same type of treatment. It's important to note that what fuels the fibroids and what makes them grow are the same hormones that keep a woman being a woman. So it's the same estrogen, the same progesterone. So even when it comes to treating them, one has to consider where fibroids actually get their fuel from in terms of the treatment that is going to be given. So when it comes to treatment, a patient's age is something that is important because we know through various studies that once a woman reaches her menopause, when she stops having her periods, and those hormones reduce in her body, you're going to find that the size of the fibroids are also going to be shrinking in size. So age is something that is taken into consideration when treatment plan is being formulated. Symptoms as well is something that is very important. Remember, not every fibroid causes a symptom. And if you find that the fibroids are small in size and they're not causing any symptom, then there's no need of actually getting to treat them. So size is something that is very important. Size will determine whether or not it's going to be an operative type of management or a medical type of management, or simply just allow the conservative approach. The number of fibroids as well, and the precise location. Just like I mentioned, the location of a fibroid is one of the major contributing factors to the symptoms that a woman can actually have. Finally, a woman's fertility goals are also taken into consideration. Is this a woman that is trying to conceive at the time when you make the diagnosis of uterine fibroids? Because you find that with fertility itself, once you start disturbing the hormonal part of it, then you start affecting the woman's fertility. So fertility goals are also something that needs to be considered every time a woman comes in for treatment of uterine fibroids. And I must emphasize, one size does not fit all. So each person will get an individualized plan based on their age, symptoms, and what their fertility goals are. So some of the myths that are associated with uterine fibroids. All uterine fibroids are symptomatic. That's a huge lie. Like I said, fibroids are usually diagnosed incidentally in most women, meaning they themselves will not even know that they had fibroids, meaning they had no symptoms whatsoever. They were having their normal menses, they're able to conceiving, even giving birth. You find that some of them are actually even diagnosed in pregnancy when a woman comes in for a pregnancy scan. So fibroids always cause infertility. That's another myth. There are women that conceive with fibroids, carry their babies to term with fibroids. So not all fibroids can cause infertility. Fibroids are cancerous. Huge lie. So fibroids are non-cancerous. The majority of them are non-cancerous that are out there. Hysterectomy is the only treatment for fibroid. In the preamble and the story that I just quoted, you found that a 26-year-old woman who had no children had uterine fibroids, and the doctors recommended removal of the uterus. That is, hysterectomy is not the only treatment for uterine fibroids. There are other options that are available. And like I said, these treatment options will depend on your age, the number of symptoms that you actually have, and also your fertility goals. Having fibroid means you can't get pregnant. That's a huge lie. Women do conceive even with uterine fibroids, and you find that when they do conceive, they even carry their pregnancies to term. Of course, there might be a few complications that might come into play with a pregnancy that has uterine fibroids in it. And it's important that once you conceive with uterine fibroids, you book as early as possible for antenatal care so that you're followed up with a specialist who will guide you through your pregnancies and help handle some of the challenges that you might have. Thank you very much. This was Womb Care's short presentation on uterine fibroids, just to help raise awareness and to help educate the masses on uterine fibroids. I'll now leave it open if there are any questions out there that I can take and answer. That would be perfect. Are there any questions? There was a comment in the chat box saying, "Thank you, Doc. We shall start smoking to end fibroids." Yeah, following as a father, a man, brother, friend, colleague, and everything, I can be in support of our women and girls everywhere. Thank you very much, Mr. Bibo Boniface Musoba, for that. Very, very lovely. Um, can early use of contraceptives cause one to have fibroids? My 16-year-old niece was put on contraceptives for heavy bleeding. Thank you very much for that important question. To start with, you find that contraceptions do carry a lot of myths. There's a young girl who's not even sexually active, being put on contraception, and you find that the family will raise this anger to say, why are you putting somebody on contraception? She's not having sex. But you find that contraceptions can help with the regulation of bleeding, just like the 16-year-old was put on it. And you find that contraceptions have been shown to be protective against one developing uterine fibroids. So they do not put you at risk of developing uterine fibroids, but you find that they actually have a protective measure for you in terms of preventing uterine fibroids. We've got Joella says very informative presentation. Thank you very much about that. There's a question in the chat which says, is it true that late conceiving predisposes to uterine fibroid? Thank you very much for that important question, Ms. Mutinta. So in some of the risk factors that I mentioned when it comes to uterine fibroid, you find that having been pregnant before with a pregnancy beyond 20 weeks has been shown to be protective against uterine fibroid. So it means that the longer your body is exposed to just the natural hormones that you have in your system, the higher the chances if you already have other risk factors in your body for developing uterine fibroids. So to answer your question, yes, late conceiving can predispose one to uterine fibroids. As long as maybe there are other risk factors that are at play as well. For example, you're Black, there's a family history, you find that that can actually predispose you to having uterine fibroids. There's also a question, can fibroids come back after they have been removed? A very, very important question. This question is covering surgical management of uterine fibroids. And please remember, not everybody qualifies for surgical management of uterine fibroids. There are very specific people that can undergo myomectomy, which is a surgical removal of fibroids. And this procedure simply involves cutting out the fibroids that are visible and that can be seen by a surgeon during an operation. Unfortunately, you find that if there are multiple fibroids, even after an operation, these fibroids have got a risk of returning because it's not just one fibroid that is growing. Some might be microscopic, if I can put it that way, where you cannot see them in the operation. And once you remove the ones that you can see, the ones that you can feel, you find that the little seeded ones, as long as you're a woman who remains of reproductive age, has got a chance of actually growing back. Studies have shown the fibroid recurrence rate over a 5-year period in some is about 15%. In others, it's as high as 50 to 60%. So fibroids can reoccur after removal. Do we have any other questions? So there's a question from Baleka says, thank you for the presentation. Can fibroids be prevented? So when it comes to fibroid prevention, healthy lifestyle is key. 100%. So you find that how you can help prevent the fibroids is that, number one, live a healthy lifestyle. Because if you look at some of the risk factors that are actually out at play, you find that having more red meat than your greens puts you at risk of actually developing uterine fibroids. You know, alcohol puts you at risk of developing uterine fibroids. Hypertension puts you at risk of developing uterine fibroids. So the most important thing is for you to actually live a healthy lifestyle. And that is some of the remedial measures that one can work towards when it comes to the prevention of uterine fibroids. There's a question saying, is there any medication that can dissolve fibroid? Thank you very much for that question. Something that is very important is to understand where the fibroids actually come from. So when we understand where they come from, which is the muscle of the uterus and them responding abnormally due to the hormones, and please note that these are the hormones that actually keep you as a woman being a woman. So when it comes to medication that can disturb those hormones, you find that there are some drugs that can disturb those hormones, which might lead to a reduction in size of fibroids. There are medications out there that might lead to even about a 50% reduction over a 6 month period. And that is where, I guess, dissolving falls into place. So there are actual medications that are there. There's also other surgical procedures where you infiltrate, put some medication that goes to the blood vessel of a fibroid, and you occlude the fibroid and sort of cut off that blood supply and allow the fibroid to die off. And that's also something that can be done in terms of treatment of fibroids. There's another question which says, if one is diagnosed with fibroids in pregnancy, do they have to be removed after delivery? Thank you very much for that very important question. And I think this is a question that a lot of women have actually asked me during their antenatal to say, okay, I've got uterine fibroids. Now, how do a Caesar for me so that you can actually remove them? The thing is that not every fibroid requires an operative removal. And doing a myomectomy, which is a fibroid removal at the time of a cesarean section or at the time of delivery, is something that is actually discouraged. Why? Because the uterus receives so much blood supply during that period of time that if you start cutting into it to remove a fibroid, that is most importantly, not occluding the pathway where you want to remove a baby. You find that you predispose the woman to much more risk and much more bleeding. So removal of fibroids at delivery in terms of cesarean section is something that is not advisable unless the fibroid is sitting in the pathway where one has to deliver a baby from. So not every fibroid, even in the postpartum period, after a woman has recovered, her uterus has returned to normal, as long as the fibroids are not symptomatic, as long as you go through the criteria of the treatment plan, not every fibroid would need to be removed. So can fibroids ever be cancerous? Are they always non-cancerous? That's the question that we have from Dr. Bev. So in terms of fibroids being cancerous, there are conditions that are called myosarcomas, which are cancerous fibroids, but these are very, very rare form of fibroids. And even clinically, in terms of when one is removing the fibroids, you can tell to say the tissue that you're taking out is not very good tissue. So there's some that is very rare that they can be cancerous. But in all essence, uterine fibroids are non-cancerous. There's a question which says, from Dr. Zulu, I once saw an advert that sanitary pads can dissolve fibroids. Please comment on that. Thank you very much for that. I find it a little bit difficult to understand how the fibroids can actually dissolve how sanitary pads can actually dissolve the fibroids themselves. More especially considering how the fibroids come about in all essence and how they are fueled by these hormones, the estrogen and the progesterone that cause these cycle changes that a woman actually goes through. So unless the pads themselves are impregnated with hormones, then maybe it's possible. But I think I'll definitely need to look around and do some research and reading on that. So it's very, very interesting. But unless they're impregnated with hormones or unless they're impregnated with medications that will disturb the hormones that one is actually ones that are circulating in your system, it's hard to see how they'll be able to dissolve those fibroids. There's a question as well from Jacqueline. How can I tell if my symptoms are due to fibroids or something else? A very, very important question. The biggest challenge with diseases that originate from the pelvis, the female reproductive organ, you find that they can sometimes overlap. There are so many diseases out there that can mimic each other. And that's why every time that one goes to a medical profession for advice, for an evaluation, there's always that list of diagnosis that can actually for that particular disease. So it's hard for one to tell, but what is important is that there are specific symptoms that are linked to fibroids, but that can also be linked to other diseases. So heavy menses, very painful menses, you find that those can be differentiating factors to say, okay, maybe the disease process that you're having is a disease process that is affecting the inside of the uterus and the muscle itself. But when it comes to actually making that particular diagnosis, it's important that you seek consultation and you do imaging, ultrasound in particular, to help see what is actually causing those diseases or those symptoms that one is having. There's a question from Thelma which says, what is the role of non-steroidal anti-inflammatory drugs in managing fibroids? It's seen a number of obstetricians and gynecologists prescribe mefenamic acid and tranexamic acid. That's a combination that is used in terms of managing one, patient's pain in particular. And something that has been known about fibroids is that they cause a reaction around themselves. Some, more especially the fibroids that are found on the inside of the uterus. So you find that there's this reaction and irritation that they actually cause. And these non-steroidal medications, they help manage that reaction process and thereby reducing the amount of bleeding that somebody's having and also reducing the amount of pain that someone is having. Whilst with the tranexamic acid, you find that this is a drug that simply helps platelets stay together, meaning helps your blood clot and thereby reduce the amount of bleeding that one is having. There's another question from Jackie which says, can fibroids be present without causing symptoms? 110%. A woman can have fibroids and not have any symptoms whatsoever. And you find that, like I mentioned in the presentation, majority of fibroid diagnoses are usually incidental. So you find that, for example, a woman misses her period and she goes to the hospital to try and do a scan to establish what is the age of her pregnancy. And at that point in time, the scan actually then shows her that she's got uterine fibroids. Or a woman who's had an ovarian cyst being followed up with a scan, and they find that, oh, other than the cyst, you've got fibroids. So fibroids can be there without having any symptoms whatsoever. So there's another question in terms of the risk factors of someone developing uterine fibroids. When it comes to these particular risk factors, what we're talking about is like one, simply being Black puts you at risk of developing uterine fibroids, which is quite worrisome. Also, the genetic aspect as well puts you at risk of developing uterine fibroids. If there are fibroids in the family, it means there's a chance that you might also have uterine fibroids. Lifestyle as well comes in at play. An unhealthy diet puts you at risk. Alcohol puts you at risk. You find that getting older, unfortunately so, and we're all bound to get older. Hopefully, if God blesses us, you find that the longer one is exposed to the hormones that are there in a woman's natural cycle, you find that that also puts them at risk of developing uterine fibroids. For some, you find that there might be all these factors together. For others, you find there's just one because of the way your genetic makeup is. Just having that one risk factor can actually cause you to have uterine fibroids. I think I've answered almost all the questions that we have in our chat box. This was just simply a fibroid awareness webinar where we just wanted to shed some light on uterine fibroids, which are the most common tumors that are found in the female reproductive tract. And they can be symptomatic for many women, causing very heavy menses, extremely painful menses, which can actually lead to one not to function properly, take 6 days off. And it's important that we begin to understand the symptoms and to know that there's help that is out there. There's a question from Dr. Babe which says, if a woman has never had pelvic ultrasound done, never had any symptoms of fibroids other than the occasional painful periods, can we opt to have a physical examination just to check? It's very important, first of all, for every woman out there and for everybody to just be able to do yearly medicals. And when we're talking about yearly medicals, that is something that is just important for your own health. I know most of us only go to the hospital when we're not feeling well, when that's not supposed to be the case. Ideally, every year we need to do a physical where we do our blood workups. And for a woman, you do a full gyne evaluation where you might need to do a scan just to make sure everything is okay. You need to do your routine pap smear, your cervical cancer screening. That is something that is very important. So yes, if somebody doesn't have any symptoms whatsoever, has never had anything that would be suggestive of them having uterine fibroid, then it's important that they actually do just get checked. And a physical examination is one that is still very important because it falls under a full gynecology evaluation, which is something that is very important for any woman to undergo. I hope that answers your question. It appears we do not have any more questions in the chat. Um, unless there are any burning issues. Okay, so there's a question. Thank you for your presentation, from Ruth. How would you help with pain management in pregnancy with fibroids? Very, very important question. And you find that uh, women that do get pregnant with uterine fibroid, like I mentioned in the presentation, get to visit the hospital a little bit more frequently than women that do not have fibroids. Some of the major complaints that they come with are pressure symptoms because you find there's a fibroid there, there's a baby that's growing there, and you find that that weight is a little bit extra in the way that it's there. And sometimes you find that these fibroids in pregnancy can undergo some sort of death, if I can put it that way, where they've got reduced blood supply that is going to them, and these are part of the pain that actually women get to experience. And if a woman in pregnancy experiences any such pain, it's important that she seeks help as quickly as possible to always rule out other complications that can come into play. And when it comes to pain management, we look at medications that are safe for the baby and that are safe for the mother as well. And you try and balance those things. So you find that painkillers will be titrated based on your pain score and also based on the safety that is required. But the goodness is that pain management is there for a woman who has uterine fibroid. Something that is also very important is that exercise in pregnancy is also very important because this helps alleviate certain aches and pains that a woman might actually have. So that is something that is important for women to participate in. So there's a question, can fibroids be prevented? It's it's a tough question to answer, though there are certain measures that have been shown to help prevent fibroids. Like I mentioned earlier, healthy lifestyle, 100%. Because with a healthy lifestyle, what you're doing is that you're getting rid of some of the risks that might predispose you to having uterine fibroids. And with these risks, we're talking about, obesity, we're talking about drinking, we're talking about where you change your red meats to your greens in particular. You find that these can help alleviate you from developing uterine fibroids. So these are some of the preventive measures that are actually there. I don't know whether there are any other burning questions, but we're now coming to the end of our webinar. I would like to thank everybody that logged in. Please note that this was recorded and we'll be able to share it on our Womb Care Clinic channel on YouTube. We should be uploading it by tomorrow noon, and people can get to watch it back and um, guess in case they missed anything, they'll be able to catch up on that. And you can also share it with a sister, you can share it with a friend. And we're excited to let you know that in our next presentation, almost 2 weeks from now, We'll be having Scars of Womanhood series where we'll get somebody who's actually undergone fibroid treatment to come and speak about their experience, how it was, their diagnosis, and how their healing journey has been. Thank you very much to everybody that logged in, and I wish you all a very, very lovely week ahead.